was diagnosed in August the 19th with triple negative breast cancer. It stops your life, it stops the clock, it's emotional, and you're scared.
We tell people the big C doesn't stand for cancer, it stands for cure.
The office staff told me that this is a family environment, and we treat our patients like family, and we just want to let you know that from the beginning.
We want patients during some of their scariest time to feel as cared for as can possibly be.
We're able to kind of sit there with them and help them, process that. So, patients never feel rushed. All their questions are always answered. And I think these days in big cancer centers across the country, it's hard for them to maintain that kind of relationship with the patients. But we've been able to do that here at Marin General.
We have a multidisciplinary team, and we like to think that from the time they arrive all the way through their journey of cancer, they're in this cocoon of care.
As someone who had faith in me, and she had so much faith in me, how could I not?
Taking care of people to the best that can be done in this country, not just in this building or this county or this state, but in the country or in the world, is our priority.
We were recently awarded the Outstanding Achievement Award by the American College of Surgeons. Getting treatment here, you can expect at the end of it, your survival rate will be as good or better than across other parts of the country.
We do some of the most complicated surgeries in the deepest, darkest areas to kind of get to. We're doing it through literally incisions that are about this big. We have instruments that are the size of the tip of a pencil, and we're able to cut out these big tumors and take them out through much smaller incisions. That all translates into less blood loss, shorter hospital stay, shorter convalescence, faster time to work. And so patients are able to kind of get back to their quality of life without necessarily compromising their cancer outcome.
We're fortunate that we are able to get 2 state-of-the-art linear accelerators. One of the advanced treatments that we will be better able to do is something called stereotactic radiosurgery. That's where we use our radiation machines to focus treatment very, very precisely at small tumors, for example, brain tumors, lung tumors, spine tumors. And we can do that in as little as 1 to 5 treatments, so a much shorter course of treatment, much more focused, and with a lot less side effects.
We have really ramped up our game here at Marin General to provide the breadth of services to our patients so that they get what they need.
They just take care of that stuff that you don't have to as a patient. We have enough going on.
We offer personalized care that many of the larger institutions aren't able to offer, such as patient navigation services, such as a comprehensive Center for Integrative Health and Wellness right here in the Cancer Center. Having the close proximity of all of the different cancer departments, medical oncology, radiation oncology, creates a much more convenient and supportive experience for people.
Patients have their best outcomes when their doctors and nurses and dietitians and social workers are working together on their behalf.
We have a room of 20 people who meet, and we exchange ideas in a multidisciplinary way. And I think patients feel really comforted knowing that we have all spoken to each other about them and we have a unified plan for their care.
It's so powerful as a patient navigator because every day I get to hear how their lives are improved and how their care has been improved and their experience has been improved as a result of the generosity of our community members.
When they help and they contribute to a service like this, they contribute to people like me. Grateful people, grateful to be alive. My children are now going to have a mom who made it through cancer. My husband has a wife. My family, my parents have a daughter. They help me. I'm going to make it.
I believe that everyone is entitled to the very best care that's available. It's been our goal to bring the latest in technology and treatment modalities to all of the patients in Marin.
There's a lot of cancer diagnoses in Marin, and so if we were not here, I think patients would have to travel a ways to get the care that they need and deserve.
So having everything at home in their backyard, in an easy place to get to, and knowing it's top of the line, what more can you ask for?
future looks good. I'm now cancer-free. I am now going to move on. But this part, I'm never going to forget. I'm a survivor, and I made it. My family's so grateful to have me here, and I'm grateful to have me here. And thank you.